Today, all we're going to look at is the primary survey when we come across a casualty who is unconscious and unresponsive. There's things we need to go through to keep you safe and everybody else safe that's around. So, first of all, we'll look at the primary survey, the Dr. ABC. Now the D is danger. Danger to you, the casualty, and anybody else that's in that area. You basically perform a little bit of a risk assessment because when you get an incident, there may be other people around, we need to look after them as well. As we walk in, all we're doing, we're looking up, we're looking down, we're looking left, we're looking right, we're looking all around. We're making sure that the area is safe for you and them. The most important person at this point is yourself, because if it's not safe for you, you could then become a second casualty and the next person on scene has got 2 to deal with. Then we're on to response levels. There's 4 we need to look at. There's A, there's V, there's P, and there's U. Now the A is alert. Does the casualty respond when you walk towards them? Are they aware of your presence? If they've not got that, we're looking at V. Now V is voice. Do they respond to your voice? Announce who you are. Tell them what you're going to do. Hi mate, I'm Dave, I'm a first aider. Can you hear me? Open your eyes for me. Just give the command, open your eyes. Nice and simple. If they respond to that, brilliant. If not, we then need to go down to P, pressure. Now with pressure, what we're looking at is gently shake the shoulders, pinch the earlobe. That should get you a response. We're looking for a flicker response from the eyelid, maybe a little bit of a verbal response because it's a little bit of pain that they felt. If we don't get any of that, we're now on to U, which the casualty is now completely unresponsive. The next step now is to shout for help. If you've got bystanders, what we need to do, can you go and get me a first aid kit? Can you call me an ambulance and tell me when it's on its way? Can you get me a defib? You also might need to think about managing the crowds or the people you've got around you. So can you look after those people? Can you move them out of the way? Can you just form a circle around me to give us a bit of privacy? They're the kind of things we need to look at. The second thing we need to have a quick check for is any life-threatening or catastrophic bleeds, because we can prioritise bleeding over breathing depending on the severity. So we've now established that we've got an unresponsive casualty, we've not got a life-threatening or catastrophic bleed, and we've sent people off for help, and we've got the defib and the first aid kit and the ambulance on the way. We now go into the ABC. Now the A is the airway. First of all, we need to open the airway to check the airway. To open in the airway, hand on the forehead, 2 fingers under the chin, and it's head tilt chin lift. We need that airway nice and wide. We need it nice and straight. With that head tilt chin lift, you may get that gasp of air as the tongue is released from the back of the throat. If that does, that then changes the B and the C, because we're now on to a casualty that has given that gulp. With the B, we go on to breathing. Now with breathing, we look, we listen, we feel. We look along the line of the chest. We listen with your cheek and your ear towards the casualty's mouth, and we feel by gently putting your hand towards the casualty's chest and seeing that chest moving if that gap closes. We do that for 10 seconds, and the reason we do that for 10 seconds is because the average adult will take a breath once every 6 to 10 seconds. After 10 seconds, if you've not got a breath, we then establish that casualty is not breathing. We then go on to CPR. With an adult who is dry, hasn't drowned, then we do 30 compressions and 2 breaths. With that, what we do, heel of the hand, place it in position. Lock your other hand over the top, keep your arm straight, lean over. Once we're there, all we do is you rock from the back and the shoulders, and all the pressure comes down through your arm onto your hands. We keep those arms locked because if we bend them, your arms will do all the work and you'll get tired pretty quickly. So from that position there, all we do is we rock nice and gently. We do 30 compressions, then we move on to 2 rescue breaths. With the breaths, again, all we do from this point, we pinch the nose, we head tilt chin lift again. Make sure that's nice and open. We need to form a seal around their mouth with yours. Once we've done that, we keep the nose pinched, keep the head back, and we blow till we get chest movement. So, breathing. Once the chest rises, we come off, watch the chest fall, we go another breath back on again. We've got a minimum, or a maximum should I say, of 10 seconds between coming off the compressions and coming onto the breaths. Now we keep going doing CPR until 3 things may happen. The casualty may show signs of recovery. They may start to move, they may start to breathe, they may start to speak. 2, the ambulance and the paramedics turn up. Now if the paramedics turn up, they will come over and they will take over from you. 3, you become physically exhausted. Once you become physically exhausted, you have to stop, because the next step is you become a second casualty, and then we've got 2 people to deal with. So that's pretty much the Dr. ABC primary survey and CPR on a non-breathing casualty who is in a dry environment.